I'm going to close this. So this is Kathy Stack. I don't have slides either, but hopefully I'll say something that sticks in your mind. So just so you know my background, I spent most of my career in OMB, where I started in 1982, mostly working on education and social services programs. And I've been in a position over the last few years where I've been able to work both with officials in the Bush administration and the Obama administration who were passionate about improving program effectiveness with all the tools that they could muster, from performance measurement to evaluation and now cost-benefit analysis. But you know, for decades, OMB's goal has been make the best use of the marginal dollar, and now in tight fiscal times, we are about get better outcomes at lower cost, which, you know, holy grail, but there's only a few places where we actually have evidence of how to do that. But there's an appetite for more. And, you know, there's long-standing challenges that you all know, but I'm just going to kind of try to get in the head of somebody who's inside government, trying to move government. First, you've got, you know, government, there's tons of inertia, and federal agencies are quite comfortable doing what they did the year before, unless somebody tells them to do differently. And in Congress, the pressure is clearly to you know, maintain political support. Very hard to take away money from any particular entity unless you can really have some compelling reason for why it belongs over here instead. And organizational silos where the communications just break down, and there are so many missed opportunities where organizations are not talking to each other about ways of doing better. Then we have the budget process. And the budget process is we have a wrong pockets problem. Does everybody, is that a term you all hear about, wrong pockets? So the housing talks about this a lot because they've got housing interventions where they are quite confident that stable housing interventions can produce savings over in healthcare. But try to explain that to the appropriations committees. Housing appropriators have their bucket, the health side has their bucket. They're not going to spend money on each other's programs. Similar, mandatory and discretionary. Entitlement programs are governed by authorizing committees who have their own rules for what they look at. Appropriators on the discretionary side do annual appropriations bills. It's very hard to convince appropriators that they should change their priorities so that they can produce savings over on the mandatory side in the entitlement programs. So again, even where it's logical, you would think that people would gravitate towards that, you need compelling evidence to come and get people to focus. And then, of course, there's the federal and state wrong pockets. We've got lots of battles that go on between federal and state and trying to cost shift in the absence of information that tells us, oh, there are certain things that if we did them, they'd be really good for the federal taxpayer and the state taxpayer. Another challenge is lack of robust measurement and evaluation tools. In the 1980s, when I came to OMB, we counted impact by number of children served. We made progress in the 90s, at least in definitions. We had GPRA, Government Performance and Results Act, which gave us terms like inputs, outputs, and outcomes. But operationalizing that inside agencies was incredibly difficult. The Bush administration, to their credit, came in and wanted to do comprehensive assessments of all federal programs so that they could judge their effectiveness, and they came up with the Program Assessment Rating Tool. Is that a term? Does everybody know about the PART? No. So we had to evaluate every program, but the evaluation was largely based on performance data. So, you know, a lot of good work went into defining outcomes and outputs and kind of important things that were good to measure. But in state and local programs, we were depending on states and localities and grantees to send us data that was reliable, that when we aggregated it up into big Excel spreadsheets, it would tell us something. And unfortunately, that data really doesn't tell us anything about impact or cost effectiveness, but we've built this apparatus that's generating lots of information, and people are looking at it, trying to make sense of it. In the beginning of this administration, we had the good fortune of having lots of money falling out of the sky to think about new program designs. And we also had leadership that came into the White House, and OMB in particular, with Peter Orszag, who'd been a CBO director, and Jeff Liebman, Robert Gordon. And these were all people who had worked with researchers or done research themselves and saw the power of a really, really good random assignment study to show you that there was a better way. And they looked for opportunities to embed that kind of thinking into these new program designs, some of which you probably know: home visiting, teen pregnancy, the Investing in Innovation program at the Department of Education. And they were convinced that we needed, just like the Bush administration had built this large apparatus around performance measurement, it was important to build a evaluation capacity and a clearinghouse capacity so we could create a repository of knowledge about what had impact and also what was cost effective. Just to give you an example of, for me, the power of a really good RCT. When I was in probably about 2006, David Olds, who ran the Nurse Family Partnership Program, had a meeting at the White House. And the political officials he was supposed to meet with were busy, so he came over to talk to the lowly career staff in the Office of Management and Budget. And what was supposed to be like a 45-minute meeting turned into a 2-hour meeting. Because in all my years of working at OMB, it was the first time that somebody who was pleading for money actually came in, and instead of just making claims about the numbers served and their reach, he actually could talk about random assignment studies and the impacts that it was showing in terms of better outcomes for children and for mothers, as well as Medicaid savings. That was unheard of. We'd never seen that. And at a time when Congress nor the administration was looking to create a lot of programs, we were able to take that example up all the way to the leadership of OMB in the White House and say, you stand on principles that we should be directing money to things that work and taking money away from things that don't. Well, here's something that works. We didn't have many of those examples. And the evidence was strong enough that the Bush administration decided to propose a new program, which they did in the 2008 budget. Congress, it was small, it was a $10 million home visiting program. And appropriations committees, both House and Senate, bipartisan basis, enacted it. And it became actually the foundation for what turned into an Obama administration program on a much larger scale, $1.5 billion. What was interesting about the Obama years was that when the administration was thinking about ramping up the program, they had two choices. One was, let's take a narrow approach where the nurse home visiting model, which had been through some random assignment trials, had Medicaid savings associated with it. And there was one option that said, if we really want to make a statement about investing to save, we should promote this model. And on that track, CBO actually scored some legislation for the first nurse home visiting program that credited the program with savings. So it wasn't a full offset, but I think it was roughly 25% to a third of the cost was recouped through Medicaid savings. The alternative strategy, which is the one that ended up being enacted, was to support a much broader range of programs. Setting a bar, however, on evidence that in order to get funded, these programs had to come forward and have very strong random assignment or strong quasi-experimental designs to show that they had impact. And that's, in fact, what was enacted. We can only imagine if we had been in a tight fiscal time, whether or not that broad approach or a narrower approach would have come to be. So there are some various things that, in terms of thinking about what would be helpful as you go forward with this, various things that the administration has done, which I think signal what we need more of. So first, back in 2011, I believe, when Jack Lew came back to OMB as the director, the Coalition for Evidence-Based Policy sent a letter that asked whether or not the Office of Management and Budget would factor in, use research and research findings to inform its decision on how it scores or costs policies and legislative proposals. And Jack Lew wrote back and said, yes, in fact, that where there are strong research designs with rigorous experimental studies that demonstrate that a certain strategy or eligibility threshold can produce savings in a different program, say an entitlement program, that we will in fact factor that in and build that into our estimates. So in the world of constrained resources and entitlements, that's a big signal. It means that to the extent that there's research that shows that certain things have an ROI, we can factor that in. Secondly, the ability to make comparisons across different interventions. So back in, I think it was July of 2012, OMB sent a memo to agencies encouraging them to take evidence into account in their budgets and also to think about ways of building evidence. And one thing that we really tried to lean into was comparative cost effectiveness and encouraging agencies to really figure out where is their data that shows that some things are more cost effective than others and how to use that. Well, it turns out that there's nothing in the federal government that does this in a systematic way. So we got really excited about the Washington State Institute for Public Policy because it was the best example that we could see for how to take this analysis and synthesize it in a meaningful way. We do have clearinghouses across the federal government. So we have What Works Clearinghouse, we have SAMHSA, I think you probably talked about some of these. And that's a really good starting point, but those clearinghouses don't really have good, rich cost data. The research is generally looks at impact, and you determine if it meets a certain threshold to be in the repository. Those standards are somewhat different, so it would be nice to think that there's a North Star that we could all point to and figure out how to converge. But we also need to create capacity to understand costs. And I know that IES, with the project that they supported with Hank Levin, did some work to try to say, well, wait a minute, maybe there are some standard approaches that we can use when we look at education interventions, which, by the way, probably would work for others as well, that if we did things in a more systematic way, you can imagine a What Works Clearinghouse of the future that has cost effectiveness in some comparative way. To the point that Linda made about simple, so, federal policymakers, they do things in 5 and 10-minute chunks. And same on the Hill, probably maybe even less, 1 or 2-minute chunks. So the importance of being able to present information in a simple and clear way, but understanding the complexity of what the research is, I think, a notion of a layered effect where you have a simple presentation that grabs people's attention, focuses on outcomes, populations, things that they will say, how are we doing on these things? But that rich, weedy documentation in the back where you researchers are all, going over it and second guessing each other and doing whatever you have to do to give the users at the end of the day confidence that this may not be perfect, it's kind of messy, but it's the best that our research establishment can come up with. So I guess I just want to wrap up by saying, if you guys can figure this out, please. There is a waiting audience. And I think there's a few big things that we could be doing that, to the extent that you are able to generate evidence and synthesize it and present it in ways that force people to think about what actions can I take. And in terms of sort of policy levers, both OMB and the budget committees on the Hill, we have policy levers that we can use to drive more dollars to things that are cost effective, but it's really hard to get people to muster the political will to change their processes until you've got that evidence that's right under our nose. So if you build it, we'll use it. Also program designs. I think the tiered evidence model that we have moved to, you think about traditional programs are often about, here's the eligible population, here's the authorized activities you're allowed to do, the dollars go out, the grantees report the data back, but there's not really a meaningful evidence standard there, and there's very little incentive for people to use evidence. Our tiered evidence programs, by contrast, are looser in terms of the prescriptiveness, but they're very focused on outcomes, and to the extent that you meet a standard of evidence when you come in as an applicant, saying, I've looked at the research, here are some evidence-based practices, or some tweaks that I want to make, but I've reviewed the evidence, I'm going to use it. And then on the going out, these programs insist on a strong evaluation so we can learn as we go. That model, if you all can figure out a way of building data on cost effectiveness, return on investment, then that same model could be blown out big time in that you're going to have people at the state and local level who they want to spend their dollars on the right things. So we can provide the flexible framework, perhaps move away from the prescriptive program models and create the incentives for outcomes and use of research. So anyway, please make it happen.